Mr. Speaker, I rise today to inform folks throughout California and the entire country of one of the biggest scandals in our state's history, which is that Governor Gavin Newsom is literally bankrupting Medicaid in our state. He is driving it insolvent through a policy that exists nowhere else in the country, in no other state, a policy of offering free, comprehensive, universal Medicaid, or Medi-Cal as we call it, to the entire population of illegal immigrants in our state who meet the income threshold. No other state has done this, and in California it has been an absolute disaster. Initially, it was estimated that this unprecedented expansion would cost just a few $billion. But now, it turns out that it's going to cost $9.5 billion just for this year. And because of that enormous cost overrun, because of the resulting shortfall of some $6 billion, Governor Newsom has just taken out an emergency loan from the general fund in order to cover payments. And on top of that, he has asked the legislature to appropriate even more money, billions more. So think about what this means over, let's say, the next 10 years. If the cost has grown from a few billion to $9.5 billion just in this first year, what can we expect year over year going forward? We are likely talking about hundreds of billions of dollars of money from California taxpayers that will be spent this next decade implementing a policy that exists nowhere else in the country to provide comprehensive care, comprehensive government-provided health care to those who are in our state illegally. And here's the worst thing. Not only is this fiscally unsustainable, but those are funds that could be going to shoring up Medicaid, Medi-Cal, and improving the system, improving access to care, improving the quality of care for our own legal residents. If you are a California citizen on Medicaid right now, the kind of coverage that you get, the kind of actual delivery of service that you get, likely is not that good. Doctors throughout the state simply will not take Medicaid patients because the reimbursement rate is so low. And so this policy of Governor Newsom and the supermajority in California is a conscious decision to put the entire solvency of our system at risk, to diminish access to care for our own residents, to in fact make it harder to get appointments because now there's a whole new population that's looking to get into the system, and doing so in a way that has no precedent anywhere else in the country. In fact, in many cases, it actually costs the state more money to provide Medicaid to a person who is in the state illegally because, number one, there's no federal funding for such enrollees, and so the state bears almost the entire cost. But even the overall cost, forgetting about who's paying for it, can be higher because when you look at, for example, the rebates for prescription drugs that are available at the federal level because the federal government negotiates in bulk, that's not available for this population that's covered by state funds. So we're actually paying more than we would for our own citizens. Mr. Speaker, this outrageous policy simply cannot continue. I am calling on Governor Newsom and the state legislature to reverse it immediately. That should be the obvious next step when the system has gone insolvent to the extent that the governor is forced to take out an emergency loan. Here in Congress, I've introduced legislation that will preserve Medicaid benefits in California and across the country for only those who are legal residents of our country. I also think we have an opportunity to rein in what Newsom is doing through the reconciliation process. And I look forward to doing that in order to protect Medicaid for Californians.